Voss, Speros here, Greek out of Medicare. If Medicare's all Greek to you, you're in luck. I'm Greek. So the question I got today is, what's the biggest frustration Medicare agents have when enrolling clients, when helping clients enroll? So there's a lot of frustrations on that one. Clients see commercials on TV and be like, I want that. And they come to you and be like, I want that. And you're looking at it and oh, that's not in your county. Oh, you don't qualify for that. Well, why not? So then you have to go in and explain what the commercial's about, what it's talking about, the benefits are, how it's all broken down and works. People just don't want to hear that. They just want what they want because they saw it and it says it's for everybody. There's also enrollment process, going through finding a plan that works best for what they need, and then the doctors aren't in network. Then at that point, it's another conversation. Well, you can have this, but you can't have that. You might have to change your doctors. Well, I don't want to change my doctors. All right, well then, we can do this, but you'd have to change your drug. I don't want to change anything. I just want this other thing. So there's a lot of back and forth when finding plans. Luckily, in Arizona, there's a lot of Advantage plans to pick from. Some things frustrating things on the supplemental side, people are like, I want to go back to original Medicare and a supplement. I'm like, all right, that's great. Let's fill out the forms. There's qualifying questions for that. There's medical underwritten qualifying questions. If you've been in a skilled nursing in the last 90 days, that's an instant disqualifier. You can't get it. Can't apply. Boom, sorry. If you have major health issues, you're going down the list. Oh, that's not a disqualifier, but I want it. This is what I need. I was told. I'm like, I'm sorry. And then there's people that go on and a supplement and then an Advantage for the first time, and you get a 12-month grace period to try it out. And then after that, you're supposed to go. And then if you want to go back on the supplemental plan, you can. And then that's sometimes a struggle as well, depending on how you exited the first time in the beginning. If you didn't do it right and talk to a broker and have them help you, and you just dropped your plan, then, it might not work out the best in the long run. So there's a lot of frustration things when helping people out with, insurance. It's not, it's not everything. There's a lot of, give and take on everything. A little pull, a little tug, a little, moving around, trying to figure it out. But it's okay. That's what we do. So every year we go through a lot of training, starting July, August, September, to get ready for open enrollment, to see what's new and what's going on. If you have any questions, if you are frustrated with your plan, let us know and we'll see what we can do. Hope you have a good day.